Good morning. How are you all? Today, my tip for today or for a weekend tip is lumbar pain. Points for using lumbar pain or any paralysis of the lower extremities and limbs. These are excellent points that can be used. And also what is important, also the direction of the points, the needling direction can have a large effect on these points. So I don't have to explain the reasons or the why patients appear with lower extremity pain or any lumbar pain. This is not only for lower back pain, but also for paralysis, weakness of the legs, foot drop, and etc., numbness of the lower limbs. So I'm going to go straight away to my PowerPoint so I can show the points, the locations. And hopefully you can use it in your clinic. They're very useful points. Okay, and share. Okay. So, like I said, I'm gonna explain about these points. So, as you can see here, I have around 4 points which can be used for treating lumbar pain or any lower extremities disorders. You can use these points on the ipsilateral side or contralateral side. Mainly use these points on the same side of the pain or the problem. So the first point I'm going to look into here is what is called, where you can see the L1 T12 point. This is a point which is on a somatotopy of Yamamoto's area, which reflects these areas. Now, between L1 and T12, because of the difference of the size of the vertebrae, a lot of patients suffer from pain which originates here. And we always treat in the lower areas, but we never treat this area. And then the pain doesn't subside or subsides for a few hours and then comes back. There's a lot of tension in this area. Even think about it that the iliac psoas muscle connects to this area. So when you have contractions of the muscle, there's always going to be pain. So you can actually use these points to release the contraction of the spasm or the spasticity of the iliac psoas muscle. So actually what you want to do is, what I try to draw out here is what you want to do, take the apex line, and then you're going to multiply the height of the ear. Maybe it'll be easier if I do it this way, where you can see my mouse. So what I have here, I have the whole ear. I'm multiplying the height approximately on the apex line. And around this area, I'm looking for sensitivity. When I found the sensitivity in this area, I will needle it. At the same time, after you have needled this point, ask the patient to move around and see how he feels. So that is point number 1. There's no, the direction of this point, the needling direction is not important. That's point number 1. Point number 2 is what is called D point. D point has an effect of any areas from the upper area of from the navel cord down, from the navel. So what you want to look at, this area will affect any areas from that right down to the feet. So even lower back pain, like we said, lumbar pain, sciatica, drop foot, but also paralysis of the lower limbs or numbness of the lower limbs. So it has an effect on that areas, but also in intestinal problems, urinary infection, Crohn's, colitis, and etc. But I'm speaking more of the manner of pain today. Now this point is actually located, what I'm going to take the root of the ear and I'm draw an imaginary line between the outer canthus of the eye. And where this line crosses the front hairline, as you can see here, this is where the point is located. Or what you can do is take about a centimeter just above the zygomatic bone, which you can see down here, up here. This is where that point is located. You're going to look for sensitivity in this area. Now, when you needle it, it should help the pain or subside, or even see the improvement in the flow of blood to the lower limbs. Now, like I said, certain points have direction. This point has a very good direction, needling direction. If I needle towards the eye, so I'm actually treating the frontal areas of the lower limbs, or any radiating pain to the inner parts of a thigh, or to the anterior side of the leg. Basically spleen, stomach, meridians, liver meridians, and etc. But also the muscles. If I want to affect the iliac psoas or the quad, I'll be needling it forward. Okay. Another direction is from up to down. When I needle it from the upper area down, I'm actually affecting the gallbladder meridian. So it's the tensor fasciae latae muscle. Okay. So think if you have paralysis or weakness of these muscles, you can have an effect on these muscles. The next direction is actually, if I needle from anterior to posterior towards the ear, I'm actually affecting the bladder meridian, or the gluteus maximus, gluteus minimus muscles. So I'm actually treating these paralysis of these areas, or if this is the muscles that are causing problems in walking or instability. So that is an excellent point for that. Now, also for radiating pain, like I said, in those areas. The next point which I'm going to talk about is F point. F point is actually located on the mastoid bone. What you're going to do, if you go to the mastoid bone and just go up up from the sting of the mastoid process, and you just go up, the first lump or bump that you've come into, this is actually the F point, or it is actually in a straight line at the height of the tragus, the lower part of the tragus, back on the mastoid bone. This point is actually, or this whole area here, has effect also on the lumbar spine, but also on the sciatic pain, piriformis syndrome, and etc. So it's an excellent point. There is no needling direction on this point. The next point, which I very much love, is actually located on the zygomatic bone. So it's in between stomach 7, just above stomach 7, and the upper area of the zygomatic bone. There is a notch there on the front hairline. This is an extra foot. This can have effect on sprained foot, or even foot drop. And by needling this point, you will have an effect on the lower foot. Now, also this point has a direction. If I needle it from anterior to posterior towards the ear, I'll be having an effect on the palm of the foot, and if I needle it from the ear towards the eye, I'll have a dorsey effect. So this is, if I needle towards the eye, it's actually spraining the foot. If I needle and foot drop, if I needle it towards the ear, I'm actually having an effect on the bottom part of the foot. So you're looking at any pain, numbness in that area. Okay, so these are basically the points. I'm going to go back.